All right. Good evening, everybody. I'd like to call to order the December 14th Community Mental Health Full Board Meeting. Please rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item is the reading of the mission statement. Lori, could you please read our statement?
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next is the adoption of the agenda. I'll take a motion to adopt.
So moved. Support.
Motion from Megan, support from Selena. Questions, comments? Huh?
I thought it was Dana.
Yeah, motion was from Dana, but support was a tie. All right, seeing none, all in favor signify by saying aye. 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 All opposed? Agenda is adopted. Next item is hearing of the public. Anybody from the public? I don't see anybody from the public, so we will close the hearing of the public and move. They can come up at the end when they can talk about whatever they want.
Christmas carols.
Yeah, Christmas carols. Ken, looking at you first.
Any favorites?
Keep it simple. Jingle bells. We'll move on to item 5, minutes. I'll take a motion to approve the minutes of the regular meeting of the CMH Full Board held on Tuesday, November 22nd, 2022.
So moved. Support.
Motion from Selena, support from Antoinette. Questions, comments on the minutes? Seeing none, all in favor signify by saying aye. 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 All opposed? Minutes are adopted. Next, we'll move on to item 6. Take a motion to approve the minutes of the CMH Policy and Legislative Committee meeting held on Tuesday, November 22nd, 2022.
Support.
Motion from Mark, support from Lori. Questions, comments on these minutes? Seeing none, all in favor signify by saying aye. Aye. All opposed? Minutes are adopted. Next is item 7, request to approve. Item A, I'll take a motion for final approval to issue capacity building grant opportunities to all of our currently contracted providers.
So moved. Support.
Motion from Megan, support from Antoinette. Dave?
I've mentioned this at some of the previous meetings, but we've met with first responders, the police departments, EMS, our healthcare systems, school systems. It's clear that the needs of our community have increased and are increasing. We've met with the core providers, primary providers who are doing intakes, and they're struggling primarily with staffing issues. We've done the recruitment and retention and things like that. What I'm proposing is that we're intentionally vague, leaving it wide open to the providers for them to get creative and really tell us how they would propose to use some short-term time-limited funds to increase capacity. So it could be doing more marketing and outreach. It could be staff training and credentialing in certain evidence-based practices. It could be new programs, new locations, anything that would impact capacity building. The plan then would be that we would review them internally. We meet Wednesdays as the finance group. Depending on the volume, we might have to meet outside of that. The providers would have to submit sufficient detail to support the dollars that they're asking for. But for those that internally we think are truly value added, finance would work with us and tell us what funding streams we would have available to support those efforts. And then we would bring those forward to the board, saying that we support these and these funds would be available to do those. Again, just trying to meet the needs of our community as creatively as possible and maximize the use of the funds that we have available to us right now. So that's what I'm asking approval for.
Thank you, Dave. Any questions or comments? Okay, all in favor signify by saying aye. 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 All opposed? Motion passes. Next is 7B. I'll take a motion to approve the recommendation from the CMH Board Policy and Legislative Committee for Dave Pankatai to enter into an agreement with an event planner for the legislative luncheon.
So moved. Support.
Motion from Dana, support from Lori. Dave?
You are aware that Kathleen left us as the communications director, so we are missing resources in that area. So when we met as the Policy and Legislative Committee, I thought it'd be helpful to bring in some outside resources here for this specific purpose. So we are looking for an event planner, somebody who does have experience setting up legislative events is preferred. I did reach out to my counterparts. Had one lead. I reached out through their website. They've not responded back, but we are looking at some other local resources, and Sandy's trying to track down some leads for us too. So I continue to put the word out, but it would just be, like I said, this time limited to help us get the legislative event and have it be as successful as possible.
And Sandy's recruited me to help her as well. So, any questions?
Ideally, we would get more than one, and we could compare the cost, but we're having a hard time nailing down even one right now. But
Megan, go ahead.
If we know of people who do that, should we forward them to Sandy?
Yes, if anybody has any ideas, contacts, send them over to Sandy, please. Anyone else? Okay, all in favor signify by saying aye. 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 All opposed? Motion passes. Next is item 8, receive and file. We have no items there. Number 9, resolutions. No resolutions tonight. We'll move on to item 10, the voucher listings. I'll take a motion to pay the bills from 11:15 to 12:02. Motion from Selena, support from Lori. Questions, comments on the bills? Okay, all in favor signify by saying aye. 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 All opposed? Bills are paid. Management report, no CFO update, which is why I wanted Ken to sing, but we will move on to Dave with the CEO update.
thank you. Last week, I mentioned we did meet with the first responders. All of the police departments, the sheriff's department, EMS, and the health systems were present. I'd like to thank Vicki Wilbur, the Deputy County Executive, for coordinating that, and Sheriff Wickersham for reaching out to all the police departments and making sure they were present. Helen Klingert presented, along with, we had a panel, so it was Vicki, Captain Lori Mish from the jail, Barb Caskey from Community Corrections, me, Helen, and Andrew, the director of our health department. Took a lot of information there, but again, the message was clear on the mental health substance use side. They're like, what number do we call when we have an issue? And I have publicly thanked Barb Caskey, but I'll do it again. My thought, I was thinking out loud when I got that question, I'm like, well, I kind of need to know what the volume is so we can address it. And Barb spoke up and said, well, hang on, we'll get you some detail back about who to call, when to call, things like that. So I am working on putting together an informational packet that will go out to the participants in that meeting. But it's really evident that the needs in our community and what the police are dealing with is significant. Again, I did meet with St. Clair Shores Police Department individually. They're referring their mental health cases, anything related to that, to their community engagement officer. And his concern was that he would overload us just from St. Clair Shores. So every indication out there is that that when we build these connections to the first responders, we need to be well prepared to meet that need. Along that line, we did have our bidders conference today for the crisis stabilization unit. Again, that is intended to take some of the pressure off. It's the hub and spoke model, so this would be the hub 24/7 facility where people in crisis could go. First responders could direct people, take people over there, and then we could direct them to the appropriate services in the community or to an inpatient hospital if needed. Our current hospital diversion rates are honestly nowhere near where I want them to be. So too many people are going to the emergency rooms and jail, and we can do a much better job in meeting the needs of our community once this is up and running. So that was well attended. We also had a bidders conference for the marketing PR firm. We had one attendant at that, but I think we will have several more respondents to that. So we'll have to wait and see. It was not mandatory that they attend the bidders conference, but it helps. I'm working on an application for the state's pilot project for the crisis stabilization unit. So the state is looking to pilot this. There was money earmarked in the state's budget specific to crisis stabilization units. It is this time focused on adults. What we're looking at doing locally is adults and children. So we'll see how that plays out. I do need some letters of support, so I was able to get those emails out this afternoon. They're going to Vicki Wolber from the county, and then they will have the support there of the Sheriff's Department, the Health Department, Community Corrections, Macomb Community Action, and I apologize if I forgot one of the departments there. Then I sent it out to our health systems and the school system as well. So it'll be a good application response because we're also the CCBHC and the CMHSP and everything else they were looking for in that response. Successful respondents will be eligible for up to $100,000 to help get the CSU. Yeah, that's the appropriate response, Selena. $100,000 to help you set up a crisis stabilization unit is, it's like giving somebody $1 towards buying their house. But we'll take it if we get it. Luckily, again, our funding right now is giving us that flexibility that we'll be able to, be creative and support this effort. We've completed a supportive housing guidebook. So educational piece for me, historically Macomb County did quite a bit of supportive housing, which is the person living in their own home. And then they can have paid staffing supports, which is the Medicaid covered part of that. When the funding crisis hit us in 16 and 17, all of those efforts stopped, to the point where some of the messaging from the staff who'd been around during that period of time was that, Macomb County doesn't do that anymore, or doesn't provide that service. So it's like, well, yeah, we do. So we have a guidebook out. Tracy was super helpful in getting it. It's on our website. It's on the internet. And we will be doing trainings to support those efforts too, and helping people realize that there's options outside of a licensed adult foster care homes. So it's part and parcel too of working on our placement options, our community living options for people in need. I also wanted to publicly thank Ann Baichego, Andrew Fortunato, thank you. I was just calling him Andrew, and that's what I wrote in my notes. So sorry, Andrew, if you're watching on YouTube. And Denise Lacey, they were all in attendance at Commissioner Zhang. Thank you. I didn't want to pronounce her name incorrectly either. On December 10th, they participated in the Michigan Hmong Women's Association, and they presented on stigma. So they had our resources available to those groups and got some nice photo ops for our services. I was talking to Mark ahead of time, and thank you, Mark. Mark attended our final community forum for our community needs assessment. So we will be, they'll be compiling those final results. And Mark asked, and yes, the board will get those reports and things too, and they will be public. But they will help focus some of our continued outreach efforts and our future planning. So friendly reminder, the last day for your Land's End, I see Mark and Lori and Phil and Antoinette we took advantage of the Land's End. So if you haven't taken advantage of that voucher, you have just until the end of this month, and then that's closed down. And on a positive note here too, I got an email, kind of unexpected. You know, I go through hundreds of emails a day, but we had a family who had reached out to me. They were kind of stuck in the system. They needed some special attention, but their adult son was able to successfully transition to a licensed living situation. And they sent photographs and stuff. He's doing better. And they said, you know, it was kind of hectic, but things that are going really well. And he had a moment to send the email. So those are always nice to read. And I shared that around internally with the staff who had been involved in getting his the resources connected that he needed. So that's kind of a good news ending. And I wanted to wish everybody very happy holidays and thank you for all your support. And we've got lots to do going into the new year, but we are on a good path and we have a lot of good staff doing good things. Oh, and sorry, Ken's giving me the high sign too. So going back to, it's not bad news. We reported, is it on the EQI now, Ken? I'll have the expert give us an update.
Thought they weren't going to hear from me, and I just can't.
You can start with Jingle Bells and then go into the ISF. And
It's a nice transition, right?
Transition.
Everybody likes that around the holidays. So, I don't know, Dave, if you want me just to start.
Well, yeah, it was funny. I'm looking at my notes, and it was right at the top, and I just overlooked it. It's the FSR or EQI?
Right. So we submitted the interim FSR. We don't have a CFO update this month because it would be October numbers, and we're still closing the year, and I don't know that they would provide a ton of value. But last time I presented, it was numbers based on the interim FSR, which is what we submitted to the state. What we submitted, let me take a step back. When we started looking at some of the contract language as it pertains to the ISF, it looked like some of the language had changed somewhat quietly, I guess I'll say. So as Richard started digging into it and doing what he does with some of the contract stuff, started to question whether the language, as it appears to have now changed, speaks to where normally, I guess in prior years, we're able to keep 7.5% of our Medicaid and H&P revenue as our ISF risk, right? The new language, at least in what Richard is advocating at the state, I think the board members...
I haven't shared that yet, but I'll
Okay.
do a summary out to the board.
So there is some minutia he's working through in the contract language here in this email, the bottom line thinking that the switch would be from not capping it at 7.5% in total, but that we would be able to put in 7.5% per year. So that would effectively, at least in this year, double our ISF. So potentially good news on the horizon. Working with the state to try to figure out what their interpretation and intent was with the contract language change. They're hung up on some Medicaid policy, but we feel this is more of a contract issue. So there's some of these things working through, but wanted you all to be aware that this is a fairly significant issue on the horizon, and hopefully it works out in our benefit.
So again, all of our outreach efforts and pretty much all of the comments that I gave earlier, my concern is that those will be successful. Our response times on the phone, our same-day access efforts, our marketing and outreach efforts, our number of people that we're serving and that are in need will start to go up right at the same time the public health emergency ends and our revenue starts to go down. So if we're able to keep the additional funds in our ISF, that would be very helpful in helping us weather these uncertain future here. Well, it's not that uncertain. We know that the needs are significant. And once we get staff in place and make these connections, our costs are going to go up appropriately because the needs are going up. So this is an important topic. We've started, Richard gave a very detailed correspondence back to the state about our stance. Not all of the PHPs are in a financial situation where they could take advantage of putting additional funds, but we are, so that's a good thing. So we'll keep you posted, but we have alerted the department. They initially said, oh, you've reported too much money in your ISF, please fix it. And then Richard gave them a detailed response as to, no, that wasn't an error, this is why we did that, and now we're awaiting response back from the department. So yes, it is very much potentially very good news. And we are on, pretty solid ground here to do it. So
Hope so. Thanks. Happy holidays.
thanks, Ken. And with that, I will wrap. Thank you.
Thanks, Dave. Thanks, Ken. Questions, comments for Dave or Ken now that he's seated? Okay. We'll go to other possible agenda items. Reminders for January, we have program and budget scheduled for Wednesday, January 11th here at 6 o'clock. The recipient rights committee meeting that was planned on for next week, we're moving it to Thursday, January 19th at 8 a.m. in the administration building. And full board will be here January 25th at 6 p.m. Any board members have any comments, questions, anything to add? If not, I will. Thank you to all of the board members for all of your hard work this year. It's been an interesting year, and I greatly appreciate everything you guys do. Your dedication, your service helps make my job a little bit easier, and Dave helps make my job a little bit easier also. And I want to thank Dave and Sandy. Again, it's been an interesting year, but thank you for all that you do and all of our staff. You guys are fantastic. Commissioner Song did make comments earlier in our board meeting as well, thanking our staff for being there at the event over the weekend. And just thank you for all that you do. It's not a Monday through Friday, 9 to 5, and we greatly appreciate that. I greatly appreciate that. And just want to wish everybody a Merry Christmas, Happy Holidays, Happy New Year. The last thing we have to wrap up is Dave's contract, which we are very, very close on. And it will be done. We're ending on a high note. We're going to keep him. So, anybody else have anything? Nope? Okay. Thank you all. I really do appreciate it. We will move on to hearing of the public. Everybody's looking elsewhere. We will close the hearing of the public, and I will take a motion to adjourn.
So moved.
Motion from Megan, support from Antoinette. All in favor? Aye. We are adjourned. Thank you all.